My name is Monica, and I'm from the University of Arizona, which is on the land and territories of Indigenous peoples. Arizona is home to 22 federally recognized tribes, and Tucson is home to the Otoman Yaqui. University of Arizona is also a Hispanic serving institution, and this means a great deal to me as I grew up in Tucson, and I grew up along the U.S.-Mexico border region, which is 100 kilometers into the U.S. and 100 kilometers into Mexico. And actually in this image, I'm showing my Nana, who talked about holding my dad into the United States so that future generations had more opportunity. I'm also highlighting here the diversity of my educational background and that I'm a transdisciplinary researcher. So you can see here that what I have on the slide is that pollution is now the leading global cause of premature death and disease. And your zip code can be more important than your genetic code, indicating that environmental racism is occurring and we should be striving for justice. When working with environmental justice communities, there's critical and fundamental challenges, such as the limits of epidemiology and technical elitism. And this is where the voices and the experiences of those experiencing the injustice might be left out of the solution-generating dialogue. We also know that in conventional health intervention and promotion strategies have largely failed to mitigate the sources of risk for these environmental justice communities because they're focusing on the individual behavior rather than the interacting, relevant social, cultural, and political context in which perpetuate injustice. So with this said, I and students in my lab, we work towards structural change, meaning these meso and macro level changes to improve environmental quality and environmental health. And one of the things that's been exciting is looking at participatory research methods. Here I'm showing 16 different terms. These are spanning disciplines, and we're all coming to the same conclusion. You need to be engaging those closest to the challenge in the solution-generating dialogue to achieve change. These efforts of community-based participatory research and community science are transforming investigations, and they begin with listening, cultural humility, and partnership building. And so for this talk, you can see I'm showing these are the steps that 10 steps in scientific research process. What I'll be focusing on is the data sharing, data report back, and drawing conclusions and discussing results together to translate results into action. I work with community members and community scientists that span and have different intersectionalities, right? Shout out to Crenshaw here, acknowledging that these populations might be limited income, identify as a person of color, not have a college degree, be rural, and have a dominant language of Spanish. So all of the data sharing and report back practices that we do in the lab are informed by formative and summative evaluation. This means that we're drafting visualizations, sharing and co-designing, evaluating and analyzing. And so thinking about like all of these different experiences for data sharing, I'm going to show you some just images of what this might look like. So you can see the invitations on the bottom. You can see here that that's driven by a handout and booklet. People are interpreting their data, and then we're having discussions afterwards to see how people felt about the data sharing event and their own data sets. And so here there's a mixed methods approach to this data sharing and learning research. We do surveys, focus groups, and interviews. And so highlighting some of the work that started with Garden Roots, we're looking at with this community, reporting the data back about their exposure. So this is a community that was sandwiched between a mine tailings pile and a smelter. And it's a designated Superfund site, so it's getting regulatory involvement and cleanup. And so it's important in this process, community members wanted to understand if they could garden and how much they could eat from their garden. Because they were asking those types of questions, we did this community science approach where I trained them on how to collect samples. They then received all their data back. But what was critical is they wanted to know how much they could eat from their garden. And so in the data sharing experience, I unveiled this exposure assessment process and then calculated how much they could eat from their garden at different cancer risks. Granted, you could see this as no one specific data, but what's interesting to show here is that people were like, Monica, you're crazy. It's look, I'm not having 50 cups of lettuce from my garden, right? And so they would look at their estimated cancer risk from an arsenic exposure and then go back to this exposure assessment calculation and recalculate what they should be consuming and how much they could have. And then I provided them the U.S. Department of Agriculture's recommended amount of the vegetable. I continued on with this work as I expanded through community needs assessments throughout the state of Arizona, reporting back how much you could eat from your garden based on an increased excess lifetime cancer risk due to arsenic exposure. With Project Harvest, we did a whole variety of data visualizations and working with community members, community champions, the promotores, community health workers to inform the data sharing process. And in the end, we ended up contextualizing the data based on how participants are currently using their rainwater. And then we used available standards or advisories so that someone would get their data set. They would be prompted to say, thinking about how they currently use their water. They would identify their own data point, compare it to others in the community, and then compare it to a regulatory standard or reference value we were able to provide to interpret the data set. All of this work is always it always has strategies and solutions to prevent and reduce exposures, as highlighted here. And so for the last part of this talk, for going through, is that I want to highlight that it's critical to evaluate and measure outcomes. And one way to do this is to pick a theoretical framework or a theory or framework. And so these are just highlighting some of the things that have been used in Garden Roots and Project Harvest. And so when we look at Garden Roots, we wanted to see how this collaborative citizen science project combined with community first reporting and data visualizations could increase self-efficacy and trigger individual prevention and intervention strategies. And so one of the things with Garden Roots, we did see, right, people were worried that people would stop eating vegetables from their garden, but we saw that the majority would continue to garden like they did before Garden Roots, but change their gardening behavior or practices, meaning that they understood that they would have a higher exposure to arsenic through perhaps maybe their drinking water or incidental soil ingestion, and that they could continue eating foods from their garden or select foods. And looking at Garden Roots that was then expanded across the state of Arizona, we saw that this public participation, information design, and face-to-face experiences addressed information disparities, increased knowledge and efficacy, and also increased our understanding of what motivates people to engage in environmental health research. Moving on to Project Harvest, we used an environmental health literacy framework, and you can see this as knowledge and awareness, self-efficacy, and community change. So I'll take you through a couple of these examples. And so thinking about knowledge and awareness, you can see this quote where participants talking about the fact that they were able to see something that's happening at their home, and they're getting these types of laboratory results that shows exactly what's going on, and that's really valuable. And if they had any perceptions that's different than what the booklet says, they have to reconsider and say these are the facts. In a time where we're seeing that science is contested in data and there's mistrust in data and science, this is an amazing observation to see a participant reconfigure their mental model around environmental health and quality. We also, unfortunately, in Project Harvest had to cancel some of the sample collection, but we did a survey to understand how people were doing during the pandemic. And one of the things that a promotora brought up is they were like, Monica, you've been doing this data sharing with these visualizations at the end of every year. They have the booklet, the online interface, interactive online website. Let's ask them if the data visualizations from Project Harvest has helped them interpret pandemic data. And what you can see here is that we saw that the majority of people stated that based on their participation in Project Harvest and receiving results booklets, they were more comfortable interpreting the COVID-19 data and graphs. If we move now into self-efficacy, we can see here, no need to read through this whole slide. What we can see is that people were taking action that was rooted in their data set and the evidence provided. And so their actions was supported by the data. And if you wanted, this is a Sansky diagram. Right here, you can see that what people were doing to compare the results and how they were interpreting their data. So just acknowledging here, a participant saying it's a real eye-opener. And then you're like, in what way? And they're like, because you're aware that the air is polluted, but when you actually see it and are able to register it, it's a real eye-opener. Thinking about social community building and social engagement, this would be like that, looking for that structural change. And so to highlight one example is in Garden Roots. We saw that when we did the data sharing event, community members who are on a public water utility had values that were above the maximum contaminant level set under the Safe Drinking Water Act for arsenic. This is where they immediately got together, notified others in the community. We notified the state Department of Environmental Quality, and then this water utility was issued a notice of violation and fined for being out of compliance and not meeting the Safe Drinking Water Act. And so I'll end this talk with stating that we want to be thinking about our data sharing practices and the data itself as a boundary object, that these results should serve as a way to stimulate dialogue across stakeholders, and that this takes us closer to structural change and the little policy change. And wrapping up here with my practical recommendations, engage the end user and trusted community members to co-create data sharing materials. Think of the returning of individual results as a way to connect with existing knowledge, and intentionally design the report back materials as a boundary object to open the policy and decision-making window. Thank you all so very much.